Welcome to today's webinar, Getting the Information and Resources You Need for Childcare Recovery and Stabilization. As New Hampshire's childcare system and programs transition from emergency to recovery and stabilization, providers will need information and resources in order to serve children and families in a safe and healthy environment. This is part of a webinar series and is our 7th session within the series. We'd like to welcome you to this session. Please note that today's session is an hour and a half in length. Here are today's speakers on the call. We'll be providing you with a wealth of information and updates during the call. They are in order. Myself, Tracy Pond, through Southern New Hampshire Services, Child Care Aware of New Hampshire. Marty Ilg, Deputy Director of Division of Economic and Housing Stability. Christine Brennan, Deputy Commissioner of the New Hampshire Department of Education. Melissa Clement, Unit Chief of Child Care Licensing. Krisha Dubrio, Program Specialist from the Bureau of Child Development and Head Start Collaboration. Teresa Peck, Licensing Special Supervisor from the Child Care Licensing Unit. Deborah Nelson, the Bureau Chief of Child Development Head Start Collaboration. And Jen Gano-Smith from Child Care Aware of New Hampshire. Here's our agenda for today. During our time together, we'll be providing you with a DEHS update with Marty. Christine will provide you with information on the Department of Education, lens on school reopening and emerging issues. Melissa will provide an update on child care licensing. The Bureau of Child Development and Head Start Collaboration will not only provide us with an update on CCRSP Round 2, we will also be introduced to the New Hampshire Connections Information System. In addition, Deborah will discuss the Early Childhood Workforce Study, along with changes to the emergency policies. And then I will provide an update on Child Care Aware of New Hampshire programming. We will close with questions with Jen. So to start, we're going to start with Marty Ilg, the Division of Economic and Housing Stability, with her update. Welcome, Marty.
Hey, good afternoon, everybody. As always, I include a picture of my first grandson. Here he is on his first birthday, getting ready to eat a cupcake for the first time. He didn't make too much of a mess, but I think most of it ended up on the floor. But today I wanted to talk to you about something in the works that's kind of exciting. You may or may not know that the Division of Economic and Housing Stability was created in June 2018 to promote a more holistic, multi-generational, and integrated approach for individuals, children, and families who may be in need of an array of services such as childcare, housing, food, economic, and employment assistance. To date, DEHS does not have a web page on the DHHS website. There are just individual bureau pages that are really cumbersome and difficult to use, and we've been hearing, from folks for a long time that they'd like something a lot more streamlined. So to that end, we are going to be updating a web page specifically with the consumer and other folks in mind. And the web page will have a home page with a little bit about the division, just like maybe a paragraph, and then it'll have 6 icons. So the pictures will be with a tab underneath that says housing, food and nutrition, healthcare coverage, money and income, parents and caregivers, and adult care. So there'll be a picture on each tile. And then the individual will click on the tile that most closely resembles whatever their question might be. So for example, under housing, we have 211, Housing Finance Authority, Housing Relief Program. Food and Nutrition has online purchasing and pandemic EBT. Let's see, healthcare has the Division of Family Assistance. Money and income is employment supports, SNAP, security job fairs and recruitment events. Parents and caregivers is where we will have child support, child care, also links to Head Start and child care licensing. We also added, though it isn't a DHHS division, we added links to DOE because they have a lot of really good stuff about remote learning that is for parents in particular, And we also have family support warm line, New Hampshire Family Voices, community collaborations, family support New Hampshire Children's Trust, and then we'll have an adult care division as well. I'll keep you posted as to the exact web address. Right now, I think this link brings you to the DHHS address. So hoping to make things a lot easier for children and families in search of services, and also for child care providers and family resource centers to help folks access what they need. Thanks, Tracy.
Thank you, Marty. Our next speaker is Deputy Commissioner Christine Brennan from the New Hampshire Department of Education. Welcome, Christine.
Hi, Tracy. Thank you. Hi, everyone. I hope everyone is doing well on this beautiful sunny day. Can someone just give me a thumbs up that they can hear me? Okay, just because sometimes I have, okay, perfect. So I just wanted to give everybody, you can go to the next slide, an update of where we are with our school reopening. So back in May, June, and July, we gathered a start task force to help schools be reopening in September. During that time, we provided 10 recommendations for schools to reopen. And then we wanted them to use some Department of Health and Human Services guidance from the states. We asked them to make sure that they had supports for student wellness, parent supports, and we asked that they have a COVID response team and things of that nature. So there were 10 recommendations. And each school, as you know, has local control, and they all needed to make decisions on what was best for their community using our recommendations. And so what we did at the Department of Education is we collected by looking at, don't have a mechanism to collect this information, about 501 school opening plans. From this data, what we found is that out of 501 plans that we could find, there were 37% of them were in person, which is about 185 schools. 41%, which is about 208 schools, are hybrid, and 16% of the schools, which is about 81, are remote. 5% of the schools, we couldn't find a plan, but that could mean that other locations communicated with their communities. And so many of the communities are trying to, ones that are especially hybrid, have that AB model that I see. You could ask Deb Nelson and her team to say, oh, what kind of questions or what kind of updates do the schools want? So I'm sorry, I see that my audio is going in and out and I'm not sure why, I apologize. But I know that some of the information that the schools want, some of the information that they wanted was about the hybrid model and what kind of offerings are happening. Right now, we have a 21st century after school program, and we are waiting for the federal government to provide possibly a waiver so that if there's an AB model that maybe kids could go to school on the B day, I want to make a distinct difference that the schools are going to be offering the academics, but the other part of the child care and other facilities will be offering the supervision. So those are some of the updates that we have right now. We haven't heard from the 21st century. We haven't heard from that. And heard from the feds what the waiver is, but we're hoping to in the next couple of days, and we're hoping to be able to apply for that. And we do, and I thank you, Marty, for talking about our resources. If you do go to our webpage, we have lots of resources for remote learning activities. We have lots of resources there. And our 21st century person, Kathy Vestal, has put out some guidance around the after-school program, and that guidance came out. I hope that we're giving you the information that you're looking for. Forward to continue to be part of these sessions that you're having. And I just want to thank everyone for the work that they're doing. I know that these are times, and that during these times, let's remember to be kind. I just got off of a presentation with Scarlett Lewis from the Choose Love movement and child abuse and neglect. And it just, after hearing her speak, always quite motivated. She does offer a free resource to families, and there's many different curriculums. So if anyone hasn't seen that presentation, or if they're looking for resources, I would look for Choose Love, Jessie Lewis Choose Love, Scarlett Lewis, and also Shannon Desilets is part of that if you need. So thank you. And I think those are, I think I hit all the questions that were in this presentation. Sorry, Steve. Yep, there we go. And I think next is it Marty? Who's next? Melissa Clemens, is that right?
Yeah, thank you, Christine. Our next speaker is Unit Chief Melissa Clement from Child Care Licensing. Welcome, Melissa.
Hi, everyone. Thank you. I just have a few updates, kind of reminders, so that you can get the information you need possibly more quickly. We're seeing an uptick in calls and questions coming our way. We want to make sure that you're being directed to the correct person so that you get your information as soon as possible. If you're calling our main line with a question, it is helpful if you can specify in the message that it is regarding either background checks or something specific about your program, because those types of questions, background checks, or whether it's program specific, will go to different individuals in our office as they have access to different types of information. So in order to get your questions answered more quickly, it's helpful when you're leaving a message or when you reach somebody on the phone that you give them an idea of what you're asking so that they can make sure that you get to the correct person. If you have questions about the public health guidance that's listed for the child care and the Safer at Home 2.0, please make sure you're contacting public health with questions on that guidance. Child care licensing is not the expert when it comes to that guidance. That guidance was produced by public health. So make sure that you're contacting them, and their number is 271-4496. You want to make sure you're getting the right information. In addition, obviously, if public health calls you, if they're maybe doing contact tracing regarding a positive case, please make sure that you're responding to public health as soon as possible. It is critically important that you call them when you get those messages. And they are obligated to collect any information that they need in order to do that tracing. So there's no need to double check with parents about whether or not that information can be shared. That is a requirement. So please make sure you're sharing all the information that they're asking and that you're getting back to them in a timely manner. The last piece of information I have is, many of you saw that there is now a remote learning center verification form for types of programs that are operating with school-age children in order to assist them with remote learning instruction. Licensed childcare programs are not remote learning centers. We're starting to see some licensed childcare programs submit those verification forms to childcare licensing, but that is not intended for licensed childcare programs. If you are caring for school-age children in your program for more than 5 hours a day to assist with the remote learning requirements or the hybrid situation or complete remote learning, what you need to do is submit to us a waiver for those 5 hours to have children that are school age in care more than 5 hours a day. If you have questions, please contact your licensing coordinator or our office and we can clarify that for you. But if you're a licensed child care program, please do not submit those remote learning center verification forms to us, because that is not their purpose. Their purpose is for other programs that are not licensed that are providing that service. So thank you for everything you're doing out there. Thank you for hopefully taking the information I gave to you so that you can use it to get the information you need more quickly and to cut down on the volume of calls that unfortunately we are not able to answer. So it's not helpful to you either. Appreciate everything you're doing, and thanks, and we'll move on. I think it's Krisha and Terry next. So I'll bump it back to Tracy.
Thank you, Melissa, for that update. Next on the agenda is Krisha Dubrio, Program Specialist from the Bureau of Child Development and Head Start Collaboration, and Teresa Peck, from the Licensing Supervisor from Child Care Licensing. They'll be followed by Deborah Nelson, Bureau Chief from the Bureau of Child Development and Head Start Collaboration. We'll start with Krisha and with Teresa. Welcome.
Thank you. And can you just move to the next slide, please, Tracy? Thank you. Good afternoon, everyone. As Tracy said, I'm Krisha Dubril, and Terry Peck will be presenting shortly, just right after me. It's a pleasure to be joining you all today to announce our new New Hampshire Connections Information System. So the New Hampshire Department of Health and Human Services, the Bureau of Child Development, Head Start Collaboration, and the Child Care Licensing Unit are excited to announce the new New Hampshire Connections Information System. This child care search, we're announcing actually on today's call, the New Hampshire Child Care Search Portal. So the Child Care Search Portal is one part of the entire New Hampshire Connections Information System. The remaining parts of the system will be rolled out in phases between now and January. As you can see on this slide, the vision of this system is all families will find resources to make informed decisions about the child care services that meet their needs. And New Hampshire professionals, policymakers, and partners will use the system information to make data-driven decisions that improve professionalism and workforce quality to positively impact children. Can you move to the next slide, Tracy? Our mission of the system, and I'm just going to read in the next slide, I won't read off, but the mission of the system really is for families seeking care, to connect families seeking care with programs that best meet their unique needs, for programs to connect programs in early childhood, after school, and Head Start professional with resources to grow professionally and meet licensing requirements, and to connect administrators and directors to employees' professional requirement status. You can move to the next slide, Tracy. This New Hampshire Connections Information System will provide many benefits to you as program administrators, program directors, or staff and families. Designated program and directors and family child care providers will be given the capability to market their programs, unique qualities in real time to families and caregivers seeking care, as well as link families to your program website and social media. That's really what we're going to be launching. That's the first phase of this system that we're launching, and we will be telling you all about today. In addition to this feature in the system, you can see here there's many other things that you are going to be able to do. Apply for background check and status updates, or an early childhood and after school credential. This part of the system, when you log in, you'll be able to get real-time updates of the status of your background checks, as well as your early childhood after school credential. In addition, you will also be able to, this is going to be replacing the New Hampshire Professional Registry System, so which will allow early childhood and school-age professionals to search and enroll for professional development opportunities. So that's an additional part of the system. Finally, program directors and designated family child care providers will be allowed to track online staff professional development hours, background check status, and respond to licensing visits electronically. For example, if you have a statement of findings after a licensing visit, you can write your corrective action plan through the online licensing portal. So these are all features that are going to be developed in the system. As I stated earlier, the first part of the feature that's going to be launched today, or not today, but is going to be launched in the next week or so, is going to be the Child Care Search Portal. Every individual, it's important to note that every individual accessing the New Hampshire Connections Information System will need to create a personal account that has a unique username and password. It's important to note you will need to log into this every single time, and any information contained in the system will be kept strictly confidential. And if there's if there's information in it, the data that will be shared will be strictly aggregate and just in statistical data only. Okay, we can go to the next slide, Tracy. So today, what we're here to tell you about is the New Hampshire Child Care Search Portal for families seeking childcare. And the actual Child Care Search Portal will be launched on September 30th for families. Prior to that, we want to provide exclusive access to childcare programs, and there'll be designated program directors or family providers to update their information to market their program to families. Terry, after this, is going to be giving you more details on dates and how this is all going to be rolled out. But here is a video to kind of give you an overview of how designated program directors and family child care providers are going to be able to access the system to update their information and provide their unique information to the system. So I'm going to just be quiet now and allow the video to do the talking. So go ahead and start the video, Tracy.
Hello, and welcome to a personal video tour just for child care providers of a brand new online resource for anyone searching for or providing child care. Introducing the New Hampshire Child Care Search Portal. In a few moments, we'll show you how you can quickly update your program's profile. Finding an early childhood, after school, or Head Start provider can be a difficult task for families and caregivers. To support both families and programs, the New Hampshire Department of Health and Human Services has developed the New Hampshire Child Care Search Portal. It's a brand new online resource to provide child care information for families and caregivers seeking care. The website contains an online searchable list of child care providers in the state and a comprehensive view of each child care program's profile that includes, but is not limited to, the program's contact information, hours of operation, licensing reports, online family resources, ages and capacity served, and other specifics that you want to highlight about your program. Most importantly, families and caregivers are interested to know whether you are currently accepting children. As a child care administrator in the New Hampshire Child Care Search Portal, you will have immediate 24/7 access to your program's profile each time you log in. Any updates you make and save in your program's profile will be immediately visible to families and caregivers. The system will combine program information with professional registry information. For this reason, we ask that you log in with your personal email address here on the welcome page. Once in the portal, if you decide you do not want to display your personal email on the public site, you can choose to remove it by deselecting the box for email. Now, the first panel that you will see is called Child Care Profile here. Click on this long blue rectangular button called Update Program Profile. This will take you to the Profile Edit page. And this is where the New Hampshire Child Care Search Portal enables you to update your information with any changes you may want to include, except for information specifically listed on your child care license. In addition, your QRIS rating and enrollment status in the New Hampshire Child Care Scholarship and/or Preventative and Protective Program cannot be edited. Now, here's how to update your program profile. This is the same view a parent or caregiver would also see. As we mentioned, you can choose to display your personal email address to families and caregivers. But should you decide you do not want to display your email, you can choose to remove it by unchecking the box here for email. And if you move right up the page just above Program Details, you will see at the top of the screen a video link. And that will give you another look at our quick how-to video to help you navigate and update your profile. Now, if you move to the field here called Hours of Operation and Rates, you can add your fee structure or even choose whether or not this is visible to families. All you need to do is click the pencil icon to edit, and if you already have a schedule, click the plus sign to add your hours of operation. You can input additional schedules and fees. And here in the area called Share Options, when you click on social media links under the Share area, you can also update or correct your social media profiles, or even link your own website from here. And in the section here called Ages Served and Capacity, you can also choose to update your ages served, which must be within our licensed range of ages served, or your enrollment capacity for your programs for toddlers or preschool and so on. Obviously, you cannot update total licensed capacity because that is dependent upon your license, but you can edit the capacity breakdown for your available slots in those age groups. And anytime you find a question mark icon, such as here, you will find help text available for you. Now, as you update your profile, you can also enter additional areas of information for parents and families to view. Once you have updated all the information for your program, please double-check it to make sure it's visible and complete. Here's how. View it by choosing View Profile As and click the link. Now you can see exactly how it will appear to families who visit the New Hampshire Child Care Search portal. And don't forget, when you are finished confirming your information and that your updates are ready, choose Profile Edit and then click Save. It's that easy. The changes you make will immediately be updated on the site right after you clicked Save. Naturally, the more you navigate around in this site, the faster it will become for you. And one more reminder, you can update many areas about your program, except information specifically listed on your child care license. And as we mentioned, your QRIS rating and enrollment status in the New Hampshire Child Care Scholarship and/or the Preventative and Protective Program cannot be edited. Thank you for participating in the video tour for providers of the new New Hampshire Child Care Search portal in the New Hampshire Connections Information System. And note, we will be sending a brief demonstration video of the portal tour for families so that providers like you can see what families will see when the portal is live to all. Thank you.
So thank you. So that gives you a brief overview of the video of the Child Care Search portal, and that is really for you to be able to access your information and to update your personal information. What I'm going to do is pass it on to Terry Peck now, and she is going to give you some more details on the system and exactly the next steps. One thing I wanted to make you aware is the Child Care Search feature for families will be located on the Child Care Aware of New Hampshire website page. So if a family is seeking childcare, there is a button available on the Child Care Aware of New Hampshire page that says Child Care Search. Families will be able to click on that button and access the Child Care Search, their Child Care Search feature. So Terry, go ahead.
All right, thanks, Krisha. As you can see, this system enhances and combines the current child care licensing and child care aware search features to provide a tailored list of available care for families based on their needs. The Child Care Search portal is one part of a multi-part system, and we are in the process of creating personal accounts for directors and family child care providers based on your role with licensing. Over the next couple of days, someone will be contacting you to confirm the email address you wish to have your account set up under. The email address you provide will be your username in the new system and will primarily be used for your registry and training accounts. This is a personal account with the new registry system and the new information system. In addition, we will give you access to the program's information while you are the identified director on file with child care licensing. Please help us by returning these calls as soon as possible. You will receive an email once the portal goes live with information on how to set up your account and access the system. In this portal, directors and family child care providers will have the ability to highlight qualities that make their program unique and provide information to families about hours, availability, and rates should they wish to do so. You may also update your profile to show if you are currently closed due to COVID. This will assist families, letting them know that your program is not operating at the moment as your license remains valid, so you will be available online. This information will also assist the state with important reporting information as we move forward in this pandemic. Exclusive access to the Child Care Search portal will be available to programs starting September 24th. Prior to being available to families on September 30th. Programs will continue to have 24/7 access to this portal and can make changes to their profile at any time after the launch date on the 24th. Next slide. A recording of this webinar will be posted to the Child Care Aware website along with the PowerPoint and an FAQ. Once the portal goes live, you will be able to access this video and how-to guide from within the portal. If you have questions after go live and have not found the help you need through the portal resources, You may contact Child Care Aware through their live chat feature or call them for assistance. Please note that this portal is mobile and PC friendly. However, it cannot be accessed from Internet Explorer. And that's it. Thank you.
Thank you, Terry. We'll move now to Deborah Nelson, the Bureau of Child Development and Head Start Collaboration. Deborah?
Hi, could you please advance the slide, Tracy or Jen? Thank you, everybody, and hello, and thank you so much for joining us today, and hope you're able to get outside a little bit today. It's so beautiful. I have my windows wide open, and I'm enjoying this lovely breeze. And before I start today, I just want to announce some happy news for change. Our very own Emma Heath, the reason she's not with us today, and we thank Jen for sitting in for her, is because she is getting married on Saturday. So she is off doing bride things. So I'm sure we all wish her well and look forward to hearing about her adventures, you know, for her wedding and having a little time in a mini honeymoon. She can't travel like she wanted to, like many brides and other plans people have had during COVID, but you know, they'll salvage a mini vacation. So today I'm going to share with you just a quick overview, just where are we with CCRSP Round 2 and a mention of the early childhood workforce study, and then ending with emergency policies, you know, update, just where are we with all of those things. So next slide, please, Tracy. Oh, I'm sorry. Oh, okay, I'm sorry. Could you go back? I thought we had more information in that one. So, so CCRSP, so where are we? So I'm just going to give you this, there's a lot of figures here, and I didn't put them all on the slide, it would be data heavy, but I'm just gonna give you like a high level overview. So people are always wondering, so how much of the 25 million gopher funding that we got for childcare from the CARES Act have we already allocated or spent? So with CCRSP, we have allocated about 16.6 million so far for round 1. And we've made all adjustments. You know, some of you have been contacted when we had to revise the number of children you were serving upon which your round 1 funding was based, and or other changes to your funding that you were requesting. So all of those adjustments have been made. And in round 1, we had 604 programs with 419 applications representing those, including multi-site and single sites. And of the round 1 awardees, we only had 3 programs decline the funding. And that was for their own various reasons. I think some were concerned about the tax liability and some other issues. We only had 1 who applied who was not eligible for the funding, and that was because it was a relative caring for family members. And nearly all of you did a fabulous job submitting your agreements and your attestations. Only 5 programs have not submitted this information. We've reached out multiple times, so there is a possibility if there's no response that we will be rescinding that funding, in which case, you know, we will be recalculating monies that we have and looking at ways to reinfuse those dollars into the work of recovery. In round 2, we have 566 programs representing 398 applications that received their award letters. And we have, based on the new formula, which had to by necessity be a reduced formula from round 1, it was 30% of your round 1 base rate and $25 per child versus the higher rate for the first go around. And we have set aside over $3 million for round 2 funding. And of course, that'll be adjusted as we go forward and see what people want to actually spend, or if there are any of you that decide that you're not going to be able to use all the money. So how much gopher funding have we spent altogether to date? So when you add in, those of you who may have participated in the ECCP, Emergency Child Care Program, staff incentive round, and got funds to help incentivize your staff to come back to work and stay at work, that spending was over 2.9 million. So when you add the ECC spent to what we have allocated for round 2 and what has been spent for round 1, we're at about 22.5 million of the 25 million that gopher allocated for us. So what's next? What happens to the rest of that funding? Well, we just got a letter earlier this week from the governor's office in Gopher saying that we were allowed to draw down the balance of the funding. You may remember we called it a reserve, and we're going to be using that for the approved purposes of state and local infrastructure building. And what does that mean? Well, you saw your first glimpse of our exciting new information system. We want to keep building that out so that it serves all of us better. You at the program level for your data and information needs, and us at the state so that we can respond quickly to emergencies and for other issues when we need to have a handle on what's happening in New Hampshire in our field. So that will be one piece. Secondly, for local infrastructure, and and Tracy's going to speak with you a little bit about this, about a new contract with Child Care Aware and Southern New Hampshire Services that's designed to help build local capacity, and I'll let her speak to that. And then thirdly, and really excitingly, we will be providing more opportunities for online training through Pro Solutions. We're going to add our final 3 modules from the National Pyramid Model Consortium so that there'll be freebies for all of you. And because we know how expensive those can be. We already launched 3 modules and those are up and running. That was very exciting. And the consortium has 3 more that we just need to contract with them and get those uploaded. And that will be trauma-informed care, self-care for all of you to help you take even better care of yourselves as providers, teachers, caregivers, doing all of the incredible work that you're doing. And also the last one is anti-bias. And this is such a critical topic for all of us during COVID, which was eye-opening about the disparities. We have disparities, all around the country on, access to care and services that can be tied to race, and also just your ability to get the kind of services you need. So anti-bias curriculum and promoting access to all. So those are the 3 areas that we are looking at supporting. And lastly, around that, I want to say that we're very excited that through the contract, with Southern New Hampshire Services, one of the things that we did is we asked for some support to help manage the huge lift of the CCRSP programs and all the funding that we've gotten, so we can help respond more quickly to questions and your emails and be checking to make sure invoices are received and processed as quickly as possible. So Tori Black has been hired at Child Care Aware of New Hampshire to serve in that role, and we're thrilled to have Tori. So you may be hearing from Tori as we go forward. If she gets an invoice and has a question, you may get a Tori call. So that's sort of the quick overview of where we are with CCRSP and Gopher funding today. So next, I just wanted to spend a minute talking about the early childhood workforce study. And firstly, I want to apologize for any confusion. We heard that there was a lot of confusion. What is this? Who's this from? What's it for? I'm just going to put it in my trash because I don't know these people. So, hindsight's 20/20, isn't it? We all have learned that. So Diane Chase sent out another information round saying, yes, that's really, from the state. It's, and the purpose is to really get some baseline data and information on your workforce issues, because we've been hearing for years what a challenge those are. And we need data and information to be able to do our planning and funding projections and staffing needs projections and whatnot going forward. So that study is intended to do that very thing. So if you've already completed it, we thank you. If you have not yet had an opportunity, I encourage you to please do so, because the more data we have, the more representation we have, the better our planning and better our targeting of policy and funding will be around our early childhood workforce. So next slide please, Tracy. Moving on to emergency policies. Oh my gosh, those have been just moving at lightning speed, putting them in place, and we put them in place, and seems like no sooner do we get them enacted than they end, and we're doing new ones. So we're doing our best to try to keep up with all of the changes that are needed, the changes we're putting in place, and to keep you informed. So the two that are the most recent are school age care, and then absent due to COVID-19 pandemic. So I'm going to talk about those first. So the school age care one, next slide please, Tracy. So we heard you when you told us we need to do something about allowing for those children who are school age and would normally be in school those 5 hours to keep allowing billing at the full-time service level. So we temporarily put in place a policy that allows those participating in New Hampshire Child Care Scholarship Program that are authorized at the full-time service level for providers who are serving those children to bill at their full-time service level. Now, this was the caveat, and I know we explained this when we sent out our guidance to you, that Office of Child Care sent out their guidance, this is from the U.S. Department of Health and Human Services, that they wanted a distinction between being a teacher instructor on behalf of schools, school districts, or private schools, versus being child care providers that do your magic supporting children, helping children with their homework, helping make sure they understand, what they're doing. So they wanted that distinction made. So we just have to, as part of this process, have you attest that the work that you're doing in supporting children, during remote learning times, meets these criteria. So part of what we ask is a self-attestation that yes, I didn't serve as the teacher for Concord Public Schools for these 5 children sitting with me remotely. I was there, I supervised, I could ask them, but somebody else was providing the remote instruction, or children were just doing their work based on their remote instruction that happened at different times. So how are we invoicing? Well, it's a billing process like it was for ECCP and for your round 1 and round 2 of funding for CRSP. And why is that? Why didn't we just go straight through web billing like you do for everything else? Well, that was our first, we looked at first because it would make it easily wonderful for all of us, for you and for us. However, what we quickly discovered, we couldn't do it without making changes to the system, that there was just no time to make. So in other words, the data and information we need reported on who is benefiting, who is getting enrolled and taking advantage of this emergency policy, how much are we paying specifically for this policy, how many children, are being included, how many programs are serving them. We just did not have the capacity to make that happen through web billing. So it has to be separate by invoice. And I can assure you that we will, do our best to be processing when you send your invoices to us to get them done as quickly as possible and get those over to fiscal, who then has to get them to accounts payable. So yes, it's a cumbersome process, but it's a state system and we're trying to make it, work as efficiently as possible. So thank you for your patience with that. So effective dates for the school age policy are September 7th through November 30. And we especially did this because we were doing our best to try to figure out just to do cost projections. And it was really difficult without having data that we needed to try to figure out just how many children are we talking about here. We didn't know because some children that weren't in care in the summer, so it wasn't just a matter of how many bumped or needed to keep their bumped up service level from the summer up for the fall, because maybe those kids weren't in care during the summer. Maybe they were home with their parents who were, not employed because of COVID. So we're going to do it for a limited time period. We're going to document the cost, and then we will take a look again to see, if there is need and if there are resources to continue supporting that emergency policy. Next slide, please, Tracy. So, and we sent out, speaking of surveys, another survey because we were trying to figure out just how many of you are serving school-age children who would normally not be at full-time service level right now, and how many of those children were CCDF enrolled and how many of those children were not. So we figured we would send out a survey and try to get a handle on that to help inform us with our planning and our cost projections. So just the sneak peek was going to be, I was hoping to be able to present a few results to you today, but we had some technology glitches getting at the data and being able to run the data analysis. So, but I will be able to tell you, we had 232 responses, and we thank you very much to those who participated in the survey because it really will help us. That we had various program types represented, with the greatest part being licensed childcare programs, but all the way to, we had some camps, summer camps also participate. So the majority of you that participated were for-profit, 60%, and 37% were nonprofit. And the vast majority were already enrolled as CCDF providers. Is anybody else having their screen go blurry and then get sharp again, or is it just me? Okay, that's just bizarre. Okay, so next slide, please. So stay tuned. We will, as soon as we get those data analyzed and have something to report, we will happily share that information with you. So moving on, we have a new policy we're about to launch, and it's absent due to COVID-19 because, you know, timing is everything, isn't it? So we worked, everybody has been working so hard in the department to roll out the new absentee policy just under normal conditions, no COVID conditions. But on August 3rd, we rolled out our new policy of if a child attended 85% of his or her service level, then he or she, the provider would be paid as if that child attended full time, and that's within a given month. And so there's a bucket of absentee hours and, that gets replenished at the beginning of each month. I think Krisha shared some of this with you during the last webinar. But so that was the policy that hit. And so, but because of that, because of the bucket replenishing every month, we hadn't counted on COVID, where immediately kids might be out for 2 weeks right off the bat. And what was happening was with the new system, then providers couldn't bill those absentee hours the way the system is set up. So we thought, okay, what are we going to do about this? So what we did was we are going to pay up to 10 days of absences when it's directly due to COVID-19 for times when the child was scheduled to attend. So who's eligible for this? So children participating in Child Care Scholarship. And you can know that we won't use any of their absentee days. So, you know, if they're absent other days outside of COVID, you will use the normal policy and bill their absentee days that way, right through the web billing system. So for children not participating in New Hampshire's Child Care Scholarship Program, we want providers to be enrolled with us, even if you don't currently have any children receiving scholarship or have applied to enroll, because these are CCDF funds we're using to cover this policy. So, and the enrollment process is not difficult. For license exempt, Marlene will help, and the licensed programs, you know, many of you are already enrolled, but we try to expedite the process as much as possible. So the effective dates for this absent due to COVID policy are August 3rd, yes, retroactive, because August 3rd was the date that, you know, we turned on the new 85% policy. So you can retro bill back to August 3rd. So if on the first date of the new policy, you had children out due to COVID, you'll be able to retro bill. So next slide, please. So there are criteria for billing related to absences related to COVID. I'm not going to read these. These are public health guidelines about, you know, you send the child home or the child is directly exposed and they can't return until they either have an approved test that comes back negative, or they, you know, the doctor confirms that, oh, it's, you know, this child has asthma, so that's his or her typical sniffles, and, you know, based on a chronic or ongoing health condition that accounts for the symptoms. So again, in these circumstances that you can bill up for up to 10 days that the child's not able to attend while awaiting documentation from the healthcare provider, or, you know, or quarantining. Next slide, please. So when does the policy not apply? Well, if I'm a parent and I'm going on vacation to Disney and I'm taking my 2 kids out of childcare for a week, it doesn't apply to me. So you can't bill absent due to COVID if it's like a family choice for vacation. The other time you can't bill, or if a program instructs a family, if you tell the family to please contact the child's healthcare provider for COVID testing, and the parent decides, no, I don't want to do that, and I'm just going to sit out, the waiting period, the quarantine period, then if that's the parent's choice, then we will not cover that cost either. So we just suggest that you make sure that parents understand their choices, that they will be responsible for any of your fees due to absences for those situations. So how are we going to do payments? So we're going to use standard CCDF rates, whether you're enrolled in CCDF or you're not, for children aged 1 month to 155 months. And for children who are enrolled, so that it would be equitable, we will pay the family's cost share for up to those 10 days of absences. So your program will get the same amount and the family won't have to pay the cost share as children that are not enrolled in CCDF. And again, it's payments via invoicing, because this is the way that we have to do it. And this is Gopher funding, not CCDF funding. Next slide, please. So what other changes were made? Well, for families, many of you know that we were paying cost share first 100%, then we went down to 50%, and so those both ended at the end of August. And the new policy is paying registration fees as of August 3rd, up to $50 per child per calendar year that you are able to bill for. And the new absentee policy that I had just referred to, that's now in place. And for providers, a couple of the emergency policies that we put in place are now ending. And one of them is suspension of credentials and renewals, whether you're getting a new credential or a renewal credential. We are now working to catch up and to process those. We ask you to please be patient with us, because we're down 2 full-time staff, including our folks working on credentialing, while we've been working on the COVID emergencies. But we will do our best to get your credential renewal or your new credential process as quickly as possible. The other program that had been a policy that had been suspended was program quality designations. We had sort of frozen that, so whatever level you were at when the pandemic hit, you stayed there. We kept paying at that rate, whether or not you were still operating at that rate. So now, as of August 31st, we're going back to programs needing to renew their quality designations when their current designation expires, or if they want to apply for a new designation. Next slide, please. So, okay, so that's it for me. That was a lot of information, but you'll have this on the slides and it'll be posted on Child Care Aware. And feel free, to put your questions in the chat box, and we will do our best to get back to you as quickly as possible. And again, thank you so much for all you're doing and for being with us today. And I'll turn it back to Tracy.
Thank you, Deborah. I will now be providing a brief update on services being offered through Southern New Hampshire Services, Child Care Aware of New Hampshire. As Krisha and Terry mentioned, Child Care Aware of New Hampshire will be providing technical assistance and support on the Child Care Search portal when it's released. If you have questions, please reach out to us. We really want to help you with that once it's available. We have families that are calling looking for vacancies. In addition, we do have families that are looking to see what programs are providing the remote center option that Melissa was referring to as well. So please contact our referral and consultation line at 603-578-1386 extension 2531, or one of our emergency childcare lines at 603-578-1386 extension 2528 or extension 2533. You can also email us at ccrr@snhs.org. Once, of course, the Child Care Information System is up and going, you'll be able to note your own vacancies, which will be awesome. But just FYI, families are calling and they are definitely looking for care. As Deborah mentioned, we were awarded a contract to work in collaboration with the Department of Health and Human Services, the Bureau of Child Development Head Start Collaboration, on administering the CCRSP in order to support the immediate need for childcare in response to COVID-19, while establishing a holistic, sustainable, and high-quality early childhood and after-school care and education system statewide. So through this work, we will be providing training, technical assistance, coaching, and support to professionals in the field on COVID-related priority topics and issues. We're working with Pro Solutions on obtaining some online training that'll help with that endeavor. We are working with local leads to assist with regional capacity to meet the changing needs of families, businesses, and communities by developing strategies and implementing local solutions to COVID-related challenges. And this includes the formation and facilitation of an e-community collaborative. That's being done with regional representation from family resource centers and early childhood coalitions. We'll probably have more information on that in October as to the process. As Deborah mentioned, under that contract, we are also supporting a staff person. So Tori Black has joined our team as well, and she's assisting the Bureau with those CCRSP applications. We're constantly updating our current website, and we've added some remote learning resources on this site as well. So we would invite you to explore these resources and to share them with families or others as needed. Jen has been working in partnership with the Bureau on our new website as well. We hope to have this out and available in late October and early November. So be on the lookout for that. Have a nice, fresh, clean look. It looks beautiful. So our virtual annual training calendar for 2020 to 2021 is now available. There's lots of different professional development opportunities that are now available to you. We did bump back some professional development opportunities to help with attendance and support interest, because we know it's kind of a little busy time with everybody trying to figure out their own things in terms of remote learning themselves and how they're managing their programs now with the school year. So you'll find that our communities of practice on business management has been moved to later this month, and we have our peer learning community on Mind of the Making this Saturday for those of you looking for more advanced and in-depth training experiences. Our progressive training and TA options are now available, and we have moved to an open enrollment process. So you'll find a selection of options to choose from that will benefit your program, and we have recently added an option on the environment rating scales and an intro and overview on the pyramid model as well. Additionally, you'll find options tied to emergency preparedness, strengthening families, and one specific to infant toddler staff. Our early childhood cohort applications are out and are due October 9th, 2020. If you enjoy working and networking in a group, we would invite you to look at our cohort options as a means of obtaining your professional development. And we're also going to be holding our first e-conference, Keys to Quality, on October 3rd. Registration is open and cost is minimal for this full day experience of virtual learning. This is being provided in collaboration with our partners at Across New Hampshire. Thus, you will find some great after-school sessions that are also being provided. Additionally, we have some great special events being offered. There will be a No Small Matters showing and discussion with Rachel Giannini from the film. We have a training and TA institute on coaching with the Eckers. Our Family Childcare Training Institute will be on introduction to the pyramid model. And our Early Child Leadership Summit, of course, is coming both in March and this fall with Scott Noyes, and we'll be having one on graceful leadership as well. And then Scott will also be providing our Infant and Toddler Institute on brain development. So we would certainly invite you to look at what we're offering on that in that virtual calendar. That virtual annual training calendar is a fluid document, so we're constantly updating it and noting any changes. So I would always go to that to see what might be added or what might have changed as well. It's a really good resource. In addition, we'll be conducting a short survey on programs' experiences with COVID from March to September of this year, so be on the lookout for that. We hope to utilize that survey to assess programs' experiences during this time. So, and that concludes my update. We're gonna move into Jen with questions. I know that Jen's received some questions. Do you want to start, Jen?
Yes, thank you, Tracy. The first question that we had, I'm going to send to Krisha, and there's a couple different things that people wanted to know. One is, what is the website address for the New Hampshire Connections Information System? I know that you said for providers that you would get it on the Child Care Aware of New Hampshire site, or for families, but they were asking for providers.
So there is going to be, over the next week or so, you're going to be contacted, and we're going to be getting your email address. So designated program directors and family providers are going to be contacted by phone. We are going to be setting up some contact information, and then at the end of, on September 24th, I was just trying to think of the date in my head, on September 24th, you will receive an email providing you with instructions on how to access the portal, and then you can, that will be a link that you will receive personally, and you will get all your login information and everything to be able to update your program information.
Thank you, Krisha. There was another question about, does this portal mean that there's a change for staff to access their training transcripts and trainings?
So that will be future development. So that's not in this first phase of release, but yes, eventually it will be replacing the New Hampshire Professional Registry. We will be doing our best to transfer all information that is currently currently in your registry account to your new system. So if you have a training transcript, but that will be more information to follow. But yes, it will be replacing the New Hampshire Professional Registry, but that is not in effect yet. That is future development, and as we move forward, we will be announcing those future developments.
Thank you, Krisha. I wanted to draw attention that there was a question in the chat box that asked about the public health information number, and Melissa did put it out there, but it's 271-4496, just in case you missed that in the chat box feature. There's some other questions that we have. Let me just scroll down a little bit. Melissa, you answered a question in the question and answer, but could you bring that out to everybody's attention about fingerprinting?
Sure. Someone asked when you could start doing fingerprint appointments again. So the state police are now scheduling appointments. However, you are still not required to complete the fingerprinting process yet because the emergency order is still in place. But you can have staff complete it doing their fingerprints. If it's new staff, you're just going to do the same process that you did prior to the state of emergency. If you want staff that have not yet had fingerprinting to now complete the process, you need to submit to child care licensing, make your appointment, go get your fingerprints, submit that live scan fingerprint form with a check for $13.25 because you already did the state check. So $13.25 to complete just the fingerprinting portion. The original household and personnel form that was returned for them that indicated the EO18-no FBI. Return that with your fingerprint information with the check, the employment eligibility card application, and the check for $50 made out to child care licensing. So I will put that in the chat as well. But there's a new process in order to complete fingerprinting for people who submitted their background checks during the state of emergency without fingerprints. There's different information that you need to send to us. If you're sending new staff and you want to have them complete the fingerprint process now, state police is scheduling those appointments, and you can do so using the same process we had previously. Always, if you have questions, because sometimes this information is a little too much to take in during a webinar, call our office at 271-9025 and say you have questions regarding a fingerprinting process.
Thank you, Melissa. Deborah, I think there's a question here for you. Someone was asking that if they've forgotten if they've taken the workforce survey, how can they find out if they've done so already?
So if you could send an email to me asking that question, tell me who you are, then I can go to the research team that's doing the survey for us, and they can tell us whether or not you have completed it. And if not, I'll ask them to resend the link to you. Thank you, appreciate that.
And there's another question for you, Deborah. Someone wanted to clarify, can we bill for children not receiving scholarship funds if they are out due to COVID?
Yes, if you are enrolled as a CCDF provider. So that's a stipulation that we put on. So if you are a CCDF provider, yes. Children receiving CCDF or not receiving CCDF scholarship services. If you are not enrolled as a provider and want to bill, I encourage you to just go through the process and get yourself enrolled so that we can, I'll have you bill.
Thank you. Someone wanted to also know if they have already already invoiced for the child that's out due to COVID. Can they resubmit the invoice?
If they've already invoiced, you mean through web billing? And I'm wondering if they're asking if it, because if they've already invoiced and got paid for a child who was out due to COVID, we would have to take a look at that, because we don't want the child to lose out on his or her absentee hours, because the beauty of doing it this way, you know, if they're out due to COVID, they have to be out and they come back and then, you know, they're out a couple of days for whatever reason, they'll have used up all of their hours. Plus, if they're out for a couple of weeks and you try to bill through web billing, you're not going to have enough hours that month for that child. So everybody loses. So if you could contact me directly about that instance, and we can take a look and advise you what to do.
Thank you. There's Deborah, I think this one's for you as well. When will they see the paperwork for absent COVID related pay for scholarship?
So we're going to send the policy out tomorrow. So everything I just shared with you, you'll get in writing as policy. We'll, you know, get it out in through all the channels that we disseminate our information, and Tracy and Jen will kindly post it on their website. And then we will be getting the invoice packets together. So part of the instructions will be, if you want to bill due to COVID, then you can request invoice packets with instruction, and we'll have those by, I'm thinking Monday or Tuesday. Krisha, does that sound right with what finance has been able to do with us? Yeah.
Yep.
Because finance had to help us create those invoices for the data they need. So we're pretty close to having that done. So it'll be very, very soon. But again, you can back bill, you know, till August 3rd.
Thank you. Someone had raised their hand. If it's possible, if you could put your question, I don't know that I can take you off of mute. If you could put your question into the question and answer box, then I would be able to put that there. Thank you so much. I have another question here that says, can you tell me what a volunteer can actually do in a center? And do they need the 11 hours of pro-solution training?
Is it a licensed center? So that one would be Melissa.
Hi, so everyone who works with children needs to have the Pro Solutions training. So I would recommend that you call our office at 271-9025 so you can explain in detail what it is the volunteer will be doing. They have to have a background check if they're present with children, and they have to do training if they're working with children, but we can better answer that question once we have the specific information.
Thank you. The next question is, where can providers access the invoice form for COVID billing?
So we'll send out, when we send out the policy, we will send the link to the invoice mailbox, and you will send us an email saying, please send me the invoice instructions and the invoices. And that's going to happen like Monday is the hope.
Thank you. It looks like the rest of the questions are things that are going to require a little bit more in-depth pieces that we might be able to put on the Q&A form when we put it posted on Child Care Aware of New Hampshire.
Okay, so you want to use those on the question and answer then?
Yes, please.
Okay, all right, that sounds good. All right. Thank you to all our speakers today. Special thanks to the providers who provided us with questions. It's appreciated. We will get those other questions addressed and have those posted on the website. To close, we'd like to remind you to complete the session evaluation survey. This was included in your initial registration email for this webinar. This posted on the www.nh.childcareware.org website under a page entitled Recovery and Stabilization under our COVID-19 tab. This page will be populated and up within 1 business day. A reminder, professional development hours will be provided to all those participants registered in the New Hampshire Professional Registry for this hour-and-a-half of time. As a reminder, if you haven't already done so, please put your first name and your last name and your child care program in the chat feature. We make marking your training transcript complete within 2 business days. If you are on the webinar and are not an early childhood provider and are not within the New Hampshire Professional Registry, you can request documentation of your participation by emailing Donna Lake at ccrrtraining@snhs.org. For those participants who are viewing the recording of this webinar, please use the self-study sheet found at the top of the training and webinar page on the Child Care Aware of New Hampshire website. As we leave you this afternoon, we hope this webinar has provided you with the necessary updates that you need to support your work with children, families, and your staff. We hope you are enjoying the fall weather as our leaves start to turn and as any of your school children acclimate to whatever route of learning they are participating in. Be safe and well. Thank you for your time and interest in this webinar series, and enjoy the remainder of your afternoon.